Hey guys, it's Dr. Nayak. It is spring here in St. Louis. For those of you who don't know me, I'm a facial plastic surgeon that practices in St. Louis, Missouri. I exclusively do facial surgery, and because of that, almost once a week I get a text or an email or a phone call from a friend or a family member or a perfect stranger saying, hey, I hurt myself, I've got a cut, I went to the emergency room, I got stitches, and I want to make sure it doesn't scar. What can I do to make sure I don't scar after having this injury? So this video, I want you to like it and share it and save it, because I can practically guarantee that you or someone you know is going to have this question run through your head at some point in the next year or two. So obviously I can't give you specific medical advice unless you come see me in person, but I'm going to tell you what I usually tell my friends and family and what I tell my patients, and kind of give you 10 tips as far as what you can do to minimize scarring after being injured in an accident, okay? So number one, there are two things you cannot control that are still important in how you will scar. The first one is what the injury was. So the degree of injury, the more extensive the injury, the more marks it's going to leave behind. And it's the unfair truth, but that's what it is. And you have no control over that. So there are some injuries that no matter what you do are going to leave a little bit of a mark, okay? Number two is your genes and your skin type. So some people's skin and some people's genes allow them to heal from unbelievable injuries with no trace. Other people, the tiniest little thing will leave a mark. And so, again, you really can't control those two items. And so we're going to focus on 10 things you can do that you can control. Number one of the things you can control is get the wound clean. And so when you have a dirty wound, you've been scraped across the pavement, or you stepped on something, or you got a dog bite or something horrible like that, bacteria in the wound will inflame that wound, increase the chance of infection, and increase the chance of tissue loss, increase the chance of a unfavorable final outcome, okay? The wound needs to be cleaned. Most traumatic wounds need antibiotics. Number two is tetanus is a real thing. So tetanus lives in the soil. It's not just rusty knives, it's everywhere. And if you don't remember your last tetanus shot, or it's a dirty wound and it's been more than 5 years or so, it is important that you get a tetanus shot. Tetanus kills people, scars don't kill people. So don't get lost in the scar and worrying about the scar. Get yourself a tetanus shot. And almost every urgent care can do that right now, and a lot of pharmacies can even do it right now here in Missouri. All right, so the wound is clean, you're on antibiotics. The next question I always get is, does it need to be stitched? Well, as a general rule, any cut or injury that goes through the bottom of the skin into the tissues beneath, or seems deep, if you will, or you can kind of spread apart just a little bit, needs to be stitched. If the cut or injury is just in the surface of the skin, or just in the surface and middle of the skin, probably doesn't need to be stitched. And if you're not sure, like I said, I can't give you medical advice in this video, go get it checked out. You have to be seen, sometimes you have to be seen in person, so we can play with the wound a little bit and figure it out. Next question I get, stitching versus glue versus tapes, which is better? Well, tapes and glue bring the surface layers together, but the deep layers of the wound are not held together by tapes and glue. And so what can happen is, if it's a wound that really should be sutured because it's gone all the way through the surface of the skin, you're fooling yourself by having tape or glue on the surface. It looks pretty good, but then underneath that, the bottom parts of the wound are gapped apart. And so the bottom part doesn't have any strength, and there's actually empty space in the bottom part, although the surface looks like it's together. So what will happen over time is that weakness will allow the scar to spread, and or that emptiness will allow the top of the scar to fall inward, creating a depressed scar over time. So for wounds that have gone through the bottom of the skin and certainly into the tissues below, there is no substitute for layered closure with sutures. By layered closure, what I mean is the surgeon or the emergency room doctor will sew up the deep layers, bring them together, sew up the middle layers, bring them together, and then only on the very surface sew up the surface. So tape and glue might be good for very superficial injuries, but for something that's gone through the skin and definitely into the tissues below, you have to get sutures, in my opinion. All right, once you are sutured, for the most part, I let my patients get their incision lines wet. I let them shower about 24 hours afterwards, and I tell them that stitches heal best in a clean, moist environment. So what does that mean? The first few days after having sutures placed, or after an injury, the incision line or the injury tends to weep and crust just a little bit. So what I ask my patients to do is use a little bit of peroxide on a Q-tip, and gently brush away and dissolve away any crusting or scabbing that's happening around the incision line. How often? 3 or 4 times a day for 3 or 4 days, and then stop. So after the first 3 or 4 days, there's really no more weeping and crusting. And you don't need to do this more than 3 or 4 times a day in those first few days because peroxide is irritating. So if you keep doing that after 3 or 4 days, or if you do it 6 or 8 times a day, you're actually not helping, you're hurting, you're injuring and irritating the wound more than needs to be. So once again, clean wound, that peroxide is dissolving away any little scabs, any little crusts. The next thing is a moist wound. So the stitches themselves need to be constantly covered in a layer of bland, non-antibiotic cream. I would treat abrasions, which is scrapes that don't require sutures. I would treat those the same way, constantly covered in a layer of bland, non-antibiotic cream. My favorite is Vanaply. It's obviously available at almost every drugstore, usually within, they can either have it on the shelf or they can get it for you the next day. If you can't find Vanaply ointment, Aquaphor ointment is good. If you can't find Aquaphor, plain yellow Vaseline is fine. Any of those non-medicated creams are great. I would specifically tell you to steer away from neomycin, neosporin, triple antibiotic cream, anything that's got, pardon me a second. Yes. All right, I'll be right in. Thank you. I apologize for that. Anything that's got any neomycin component to it, that is going to potentially cause surface allergy and irritation. And over time, that's actually not helpful. And neomycin is not one of my favorites. So if you have to, in your mind, you have to use an antibiotic cream, use bacitracin. It's the least irritating, but really you're just trying to keep the wound moist. Constantly covered in grease wherever there are stitches and wherever there's an abrasion. All right, how long should the stitches stay in? That's another question that I get. Stitches stay in usually 5 to 7 days on the face, 7 to 14 days on the body. An area of really high motion, thick skin, maybe tension on the wound, stitches generally need to stay in longer. An area of thin skin, fast healing, not a lot of tension on the wound. We usually try to get the stitches out so we don't see little railroad tracks on there. I personally think both dissolving sutures and removable sutures should be removed at that time window, 5 to 7 days face, up to 2 weeks for body. Why is that? Because even the dissolvable sutures generate a little bit of irritation, and so yes, they will eventually dissolve, but once their purpose has been served, it's nice to be rid of them. The removable kind of sutures, which usually look like either clear or blue fishing line, they absolutely have to come out because they will never dissolve. Around those same time windows, 5 to 7 days for face, up to 14 days for body, scrapes and abrasions have usually finished healing as well. So by the time it's 5 to 7 days for face, 7 to 14 days for body, it's usually no longer necessary to put non-antibiotic bland ointment on the incision lines or on any scrapes or abraded areas. Those are usually all healed up pretty well. I also usually get asked if they should ice or elevate the area, and the answer is yeah, you can ice and elevate the areas. It's important though not to put ice or an ice pack directly on the skin because you can create a frostbite injury which is worse than the original injury. So it's always important to have an ice pack wrapped in a dry towel and take breaks, 20 minutes on, 20 minutes off. Don't fall asleep with the ice pack on the injury. Icing it helps, but it's not critical. It's not critical to making the scar look better. So I'd rather you don't give yourself frostbite than do. Elevation can help swelling as well, but honestly it just takes some time for that to go away. All right, once the stitches are out, once the abrasions have healed, it is very common for the incision line and for the abraded areas to be pink and kind of feel stiff. That is a new scar. New scars are always the ugliest. They're always stiff, they're always pink, they always seem thick. It takes time for the body to remodel a new scar. How long does it take? Believe it or not, up to 2 years for the body to fully remodel and fully mature a scar. There are things that you can do, in my opinion, that speed that up a little bit, make it look better earlier on, but the final result's still going to be a year or 2 away. So what are the things you can do at home? I don't believe Mederma is the best choice for a scar cream. It's been shown time and time again that the single best thing you can put on a scar is silicone. Silicone, it comes in sheets for the body. You can find them online readily. It also comes in gels that can be used on the face. And I have a link down in the text below to a gel that I like a lot. It's got a self-polymerizing dry touch silicone together with sunscreen. That's the other thing that you need to put on fresh scars. So this is after the stitches are out. Once there's no longer any need for Vaseline or Van-Apply, it's been a week or two, and it's a healed but pink, stiff, young, fresh scar, scrape, incision line. What do I recommend? Biocornium, and it's, again, you can see it in the link below. Biocornium is a silicone and sunscreen dry touch polymerizing product. So that's my favorite thing to use for fresh pink healing scars. How long do you use it? Until the pinkness has gone away. Twice a day until the pinkness has gone away. And by pinkness, I mean of the incision line. Pinkness spreading around the incision line with heat and swelling and tenderness, that's a different thing. That suggests infection. Again, I've said it before, this video can't replace a doctor's visit. These are general points. Any concerns, you should always go see your doctor. Finally, what do we do over time to make the incision line mature the best it can? When is it time to maybe consider revising it? In the 6 to 8 week after injury window, sometimes laser treatments can improve how that incision line is going to heal. And those can range from pulsed dye lasers to maybe help get some pinkness out. Intense pulse light can do that a little bit. Maybe some of the resurfacing or fractional lasers, maybe some microneedling. The optimal time for those things are when the wound is in its most active healing stage, 6 or 8 weeks after the injury. Okay, so that's a great time for that. When would we consider a surgical scar revision? Well, surgical scar revision means cutting out the old scar and closing it into, ideally, a less noticeable, more favorable new scar. So surgical scar revision trades one scar for another. So when would we consider that? Minimum of 6 or 12 months after the injury, because we want to see what the actual scar is going to look like. So do we really believe that a surgical scar revision is going to improve the situation? Also, the tissues are stiff, they're thick, they're not stretchy, they're not compliant. We can't really operate on those and do delicate closures in the first few months. We really need to wait for the tissues to relax, to feel soft and have normal compliance. That's usually a minimum of 6 months, sometimes a good year after the original injury. Finally, we'll often do little steroid injections or something like that to help nurse a maturing incision along. That usually happens in the first several months during the healing process, either after the original injury or after a surgical revision. So there you have it, guys. That's about 10 different things that you can do, that you can control to minimize the amount of scarring that you get and minimize the long-term objectionable appearance of the scar that you get after injury. I've said it before, make sure you get it seen early by a doctor in person. One thing I realized I skipped is in the emergency room, should you have it closed in the emergency room, or should you wait and find a plastic surgeon in a day or two? You have it closed now. You do not let it be open and fester for a day or two in the search of a plastic surgeon. You are much better off having a competent emergency room doctor close that wound early. That's much more likely to look good than waiting for a day or two and calling someone the next day and having an old wound closed. The tissues have started to change already. So you're better off having it closed early. Yes, even by a competent emergency room doctor. That's the way to go. All right, please share this post, save it for later. Check out our website if you're interested in anything related to facial plastic surgery. We have fly-in patients all the time. Thank you so much.